We're at Montfort University and we're here at the National Liberal Club, and we're here to really talk about decolonising healthcare. It's really about inequalities. It's really about a portion of the population not receiving the same support, help, treatment that others do. And we believe that a huge part of that is around education and the role that we do in relation to training our students, training our potential future workers. And we're opening up this discussion and this debate for others to have input in and to hear what we have to say as De Montfort.
We know about, and we've heard from Ivan, the importance of decolonisation of healthcare and medicine, that there's a disparity and that our current structures are not serving the community that we live in equitably. But it's about our ability as a university to respond to the health inequalities within our city. What is our educational role? What is our role in talking to our partners about placement? Which levers can we begin to pull?
That was absolutely fascinating and in some ways, very optimistic. We need a more joined up system, and this is also about educating the doctors and nurses and the clinicians and everyone of tomorrow about why we need this joined up system so that when they get there, they understand.
When we talk about decolonisation, broadly, it's very easy to kind of individualise the problems, but decolonisation is actually about looking structurally and systemically.
So I was excited about coming over because I think the conversation around decolonising healthcare is important. How do we translate the conversations around decolonising healthcare and linking it to policy? What are the conversations we're supposed to be having or could be having in policy that will help shape these changes and systemic barriers, systemic racism and structural challenges? So I think it's really important, it's really key, and we need to continually have these conversations.
We're on a journey to becoming an anti-racist university, but I think events like tonight show the developments that we've made in specific sectors. So, for example, it's been great to see the way that things like nursing and midwifery have worked to ensure that textbooks better reflect a whole range of women who would be pregnant as opposed to just white women, which was traditionally what was happening. And I'm very proud as an institutional head that we've been able to have that sort of influence on the profession and make sure that people feel properly supported within it.
I think today, I was going to say it's timely, but I think it's an overdue event. This conversation should have been happening for a long time ago. And one of the reasons is what Professor Ivan mentioned earlier, is during COVID, we saw that when we do not take these matters and address these issues beforehand, it causes real toxicity within the community.
I think the best bit is the breadth of people we've had in both the audience and on the panel. All sorts of different backgrounds, health, social care, education. That's been really important for us. What I've wanted to do as well is get the message out there, what we want to do about decolonisation of health, and to bring in others, bring in people who can work with us.